Hello, this is David Papa, the personal injury guru, and today I'm going to be here with ankle and foot surgeon Dr. Robert Abady. And he is local here. He has an office out of St. Petersburg, Florida, and he is the doctor to go to if you have foot injuries or chronic foot problems. But today we're going to talk a little bit more about the injuries that people can sustain in automobile accidents and slip and falls. And I'm going to be asking him about several issues. And the reason I'm going to be asking him these issues is because who knows what foot and ankle specialists do? Today you're going to find out. And if you have a foot problem or an ankle problem, and it's due to an accident, like an auto accident, you're going to find that you can have problems with your big toe, which is kind of known as turf toe. You're going to find out about the Achilles heel issues that you can have and several other issues. He's going to talk about some of the orthotics you can use. We're going to ask him about why you put a boot on, things of that nature. He's also going to talk about the more serious injuries that require surgery. And those are the types of things that you're going to hear from Dr. Robert Abady. So, without further ado, you will be soon hearing back from the personal injury guru.
This is the Personal Injury Guru Show with attorney David Papa.
Welcome back to the Personal Injury Guru Show. I'm David Papa, and I am here today with Dr. Robert Abady. How you doing, Rob?
I'm doing great. Yourself?
Good. Why don't you tell everybody just a little bit about who you are and what type of work you do and where your location is?
Sure. Well, I'm a foot and ankle surgeon. I've been practicing for over 20 years. I'm right here located locally in St. Pete. I'm on several hospitals in the area and a couple surgery centers and perform most of my surgeries over there.
Okay, that's cool. What, hospital privileges they call that?
Yes.
Okay, explain hospital privileges for everybody. So they've probably heard it but don't know exactly what it means.
So basically you apply, a very expensive process, of course.
Yes, I'm sure.
You apply for privileges and you have to show them credentials like your board certification. Like myself, I'm board certified in foot and ankle surgery, and your degrees and training and all your experience in the past.
Okay, very good. And we're here today to talk a little bit about the type of people that you see that have had automobile accidents or slip and falls, trip and falls, where they injure their feet. And you brought some different artifacts here with you. And could you kind of go through each of them and kind of explain what type of injuries that you see and what type of help that you give people?
Sure. Well, the foot is very complex. I mean, it has over 28 bones. It has 28, but there's also extra bones sometimes that are accessory bones that your body adapts to.
And what does that mean?
What does what mean?
Extra bones, because that scares me a little bit.
Well, in an area of friction or in a tendon or something like that, if your body creates basically a bone that ossifies when you're younger, when you're older,
okay,
and it causes an extra bone in your body. I mean, there are two most common ones are sesamoids. They're at the bottom. And I know you mentioned earlier about turf toe and things like that.
Yes.
So usually what happens is the bone it has like a force, what's called dorsiflexion of your foot, and you injure the tendons and the bones in this area of your foot.
Okay, I see. Okay, and now talk about turf toe. So how does one typically get turf toe and what is the treatment?
Well, like I said, usually it's from a forced dorsiflexion and injury, so it could either come from like a break or hitting forcefully on a break or stepping on a football field and like causing your toe to bend like that, and it causes a serious injury to the bottom of your foot.
Okay.
And the joint. What ends up happening if you don't take care of it is arthritis to your big toe joint.
I see. It's painful, isn't it?
Yes, sir.
And let me ask you, have you ever seen that in a trip and fall, slip and fall accident or an automobile accident?
Of course. I mean, usually with accidents, different types of accidents cause different problems. Usually it's sudden, so you really don't have time to prepare for the type of injury you get when you have an accident.
Right. All right. So I walk into your office. I've got turf toe. What do you do for me? How are you going to fix this problem for me?
Well, I mean, I would definitely order an X-ray or an MRI. X-rays are better to see your bones,
Right.
and MRIs are better to see your tendons and ligaments and injuries like soft tissue injuries.
Sure.
So it would depend on the different types of injuries that you have. If it's simply just a soft tissue, that simple injury like a sprain or a strain, you might end up with just like a certain like shoe gear modification or some orthotics, or basically you can also tape it up like sports tape and things like that, anti-inflammatories, range of motion exercises eventually with physical therapy when it's all healed up.
All right. So when you talk about turf toe, what would you recommend as far as, can you show like
Sure.
all these?
So basically, with a turf toe, you would try to make sure that the bottom of the insert on the joint over here would be cut out. So this way it gives it some more freedom to move up and down.
I see.
So
Okay. All right.
it would be like more of a sports thing. And the accommodations you can make to these orthotics are based on the injury. So if you have heel pain, you might have like a heel pad in there, a heel cushion, or maybe a type of injury that you have, like a injury to your tendon in your arch, you might put a little bit more support in the arch. I mean, it's pretty standard based on the injury that you have, and all that is taken into consideration when you choose when the doctor chooses your orthotic.
Okay. Now, for the more serious toe turf injuries, is there a surgical procedure involved?
What would happen is basically you'd have to, if it was severe where basically the sesamoids were atrophied or had hypertrophy or different injuries where you'd injure your sesamoid or a non-healing sesamoid fracture, you can actually take out the sesamoids.
Okay, so you can live without those, okay.
You can.
And so what's the purpose with them as compared to without them? Do you lose mobility or flexibility?
No, it just basically has to do with the way you walk, and when you step down in your gait, basically every time you bring up your big toe, it protects the bottom of your first metatarsal.
I see. Okay, so you lose that protection.
Correct.
Okay.
But
I
it's
see.
not as it's like an appendix. Sometimes people lose it in their living just
Okay,
fine.
yeah. All right. So it's not too bad.
Right.
I see. Okay, and talk a little bit about the Achilles heel, and I'm sure you must see those problems as well that come in.
Yeah, usually sometimes what happens is you have, again, except this time it's more so on the ankle when you have a forced dorsiflexion instead of a forced dorsiflexion on the big toe, you have it on your ankle. And what happens is usually you injure your Achilles tendon, and your Achilles tendon inserts in the back over here. You can see clearly over here, here's the bottom of your Achilles tendon, and sometimes what happens is that you rupture your Achilles tendon or partially rupture, or ends up over time as the injury and your Achilles tendon gets contracted, you develop spurs and things like that in the back there.
Okay, and then what do you do for that type of an injury if it's minor? Start with a minor injury.
Well, minor injury, just like anti-inflammatories and stretching, ice and heat, various different conservative, icy hot, any kind of treatment you can find over the counter, compared to more of a strain where you'd probably be in a boot for about 4 to 6 weeks. So this way you don't completely rupture your Achilles.
Okay.
Because if you completely rupture your Achilles tendon, it's a big surgery. I mean, you're talking about at least 3 months of recovery minimal on an athlete,
Okay.
where they get continuous physical therapy.
Well, we'll get back to that in a second, but the boot for a second. Let's talk
Sure.
about that boot. I see people walking around with boots, and I'm always saying to myself, does that really help? I mean, what does that do?
So the boots actually do help. Of course, the condition, sustains the treatment, but the boot actually immobilizes your foot. So it's back in the old days, you used to be able to put on a plaster cast or a fiberglass cast, and you couldn't shower, and you wouldn't be able to do certain things. But now, if in an injury, like with an Achilles, where you just strained it, you can be in a boot and you can shower and kind of do everyday activities where you don't aggravate it.
Well, that's an excellent explanation, Doc, and I'll tell you why. Because now that you put that into perspective, when I grew up, I remember people with those casts on that went from under their knee wrapped around to the edge of their foot, and you couldn't do anything, and it smelled bad.
Yeah,
it was, you couldn't shower. Yeah, oh, it was terrible.
Yeah, and
so all right.
They, when you take off the cast, their hair on their legs would be really long.
It would look terrible. The whole thing was just so undesirable. Okay, so this resolves those issues.
Correct.
All right, that makes a lot of sense. So now let's switch back. If you were to perform surgery, could you kind of describe what the procedure is and how you do that as far as a surgeon? Because people just don't know.
Sure. So for the Achilles, basically, you'd have to make an incision in the back here. Usually when you make an incision in the back of the heel, it doesn't have as good blood flow. So it actually sometimes has poor healing. So you really have to be cognizant of what the patient circulation is prior to the surgery, because if they have poor circulation to begin with, doing surgery on the Achilles area is not recommended.
Okay.
So, but basically you make an incision in the back here, and then you get to the Achilles tendon. So sometimes you can have what's called a longitudinal tear, which is long ways, or you can have a complete rupture, basically with two ends of the tendon pulling apart, and that's the most serious kind of Achilles tendon injury. So when you have that type of injury, when they're both separated from long distances, the tendon doesn't heal sometimes, and you get scar tissue in between if you're lucky. But if they're not together, then you'll get that scar tissue.
Okay.
So basically you have to try to get the two ends together and sew them over together. I like to actually bolster the repair with a type of graft or something like that, so it stays in and protects it in case the patient walks or falls, or because you know that everything happens when you have an injury to that. If you have an injury to your big toe, people will tend to step on it and never stepped on in your lifetime.
You know, that's the funniest thing, because it's true. No matter what happens, no matter you hurt your finger, you hurt anything, it's boom, it attracts attention.
Exactly.
It's
you get
crazy.
a neck injury, people will call you from in back of you all the time. So you have to twist your neck.
Yep. So that's the same thing. All right, so when you say you're going to put a graft on there, what's a graft? Is there one kind, or there several kinds of grafts that you would use?
There's several different types of companies and grafts and things like that. Usually I try to get the most inert graft that'll mesh back with your tendon. So something that'll basically incorporate and make your tendon stronger after the rehab of the surgery.
Okay, and what kind of rehab do you give people for those types of surgeries?
Well, you'd have to immobilize them for at least, like I said, 2 to 3 months, and then they'll have to get physical therapy. Aggressive physical therapy is the most important after the tendon has healed, because otherwise you'll lose motion, and you'll limp, and you'll have other things wrong with you.
And of course, when you limp on one foot, then of course the other side tends to have
and then
problems.
You'll have hip and knee problems on the contralateral side.
Right. So who does your therapy?
I usually send it out to physical therapists in the area that have done, worked on my patients and have great success with.
Okay, great. So you monitor them, and of course you see them back and make sure that they're okay and all the therapy's going well.
Correct.
Awesome. That's very good. Okay, so now you also bought some of these right here. It looks like screws and things that I'm afraid to even look at sometimes. I mean, I'm not really I'm not squeamish, but when I see things like that, it makes me really say, gosh, I hope I don't ever have to have that done.
Well, I mean, like I said, there's at least 28 bones in your foot, so right. the chances of breaking something, out of 200 bones and you have 28, so the chances of breaking one of them is pretty high.
Okay.
So, basically, if you have a fracture, like if you break your fifth metatarsal over here, you would put a plate on there to allow it to heal. And then you put some screws in, so this way, like I said, it stabilizes your fracture. So like I said, in case the dog chases you after you're healing,
of course,
it doesn't break
Right.
again.
So do the instruments you're showing us there, do they stay in your body permanently?
Usually they do. Sometimes your body can have a reaction to them, or what happens that sometimes is the screw can actually basically come out of the plate from your body rejecting it, and it's not, you can't have a screw like that, because normally after the surgery it's in like that.
It's flush.
Exactly.
Right,
So what
okay.
happens is if it doesn't get flush again and starts backing out, usually you want to try to take out the hardware.
And I've seen that on people a couple of times where you can see those little bulges coming out of their foot. So that's what that is.
Correct.
I see. Okay. And of course, then you have to do a second surgery to remove it, or do you try to put another fixture in its place?
Usually I try not to remove surgery while the actual bone is healing. But sometimes if you get an infection or something like that, you'll have to, because you can't keep a foreign body in. But if you were going to remove it, usually you try to do it after the bone or tendon is healed or something like that. So this way you don't have to replace it again.
Well, that makes sense. Okay. So we've kind of gone through everything that you brought with us. Are there any other injuries that you would typically, like breaks? And let me ask you, you hear about these breaks and things, what you just talked about, but is every break pretty much handled the same way as you just described, or are some of them different?
Definitely some of them are different. I mean, not all breaks need surgery. Some of them, if they're in place, you can just cast it or use the boot to immobilize it. Some of this stuff also is done percutaneously. What that means is basically with hardly any incision, or an incision, like minimal incision.
Okay. And now you said is it displaced and non-displaced. Can you tell everyone the difference between those two?
Sure. So basically, a displaced fracture would basically be the joint would be out of line. So it would be something like that, or it would be down like that, where the joint doesn't have the normal range of motion because it's been compromised to an injury.
I see.
So that would be a displaced. Or if it's a displaced fracture, the piece of the fragment would be moved away from the other side of the bone. So this bone would be over here or something like that, where it probably won't heal because it's too far to heal. So a displaced fracture won't allow bone to grow back on bone.
Is that when you have to do surgery?
That's when you have to do surgery, or you can get something called a non-union. And a non-union basically is scar tissue in between the two bone that won't let the bone mend together.
I see. Is that something that's more of a, I guess, not so much as an acute injury, but something that has gone on for many years?
Yeah, usually like
degenerative.
Not really degenerative. Usually
Okay.
it's greater than 3 months, or the normal time that a fracture tends to heal. So at least 3 to 6 months after the surgery, or I'm sorry, after the injury, not
Right.
surgery, after the injury,
Mhm.
where the bone heals malaligned or not together,
Oh,
there's a
okay.
space in between both.
I see. So it's important for everyone to understand. If you have a type of a foot injury where you're having pain and you're hearing it from the expert, it could cause further problem if you don't get it checked out right away, especially from what you just said. 3 to 6 months after an injury, if you haven't taken care of this injury, it could turn into now a surgical procedure rather than something that might have been non-surgical.
Correct. And like I said, a displaced fracture, sometimes you get what's called a displaced intra-articular fracture, basically that there's a fracture through the joint that's displaced that will cause arthritis because the joint is not the same way it was before the surgery.
Okay, and something to consider, which I consider this a lot because I've had a couple of injuries with my foot, and actually you took care of them, and it's funny because you had mentioned it earlier, when you have that foot on your right side, for instance, and it's hurting, you start limping. All of a sudden, the left knee starts giving out a bit. The left foot starts getting sore.
Exactly.
And all of a sudden, the next thing you know, if you don't take care of a simple foot injury, it turns into a whole bunch of stuff.
Right, and like I said earlier, I mean, it really depends on the patient. Sometimes they have serious back injuries, and you put them in a boot, they're not walking evenly because the boot is actually pushing it up a little so the other side, and they're not walking properly, and they're injure their back further. So there are things for to help that as well. They have things on the internet where you can buy. It's called like Even Up, and basically it'll put something attached to your sneaker that you're wearing on the non-injured side, so this way it evens you up when you walk.
Do you recommend that to your patients when you see them having those types of issues?
Yes, I mean if they have like serious back injuries or something like that, I mean I just tell them to go on Amazon or
Right.
one of the local things.
Much cheaper than going through all these local medical supply companies and things.
Correct.
I understand, and that's good that you do that for them. As far as a cane or crutches, when would you use one, and do you advise them?
I do. I mean, cane and crutches. Usually, there was also the knee scooter. I'm sure you've probably seen people around town that have those scooters and things like that. Basically, it's all different types of immobilization. There's also another immobilization where it's kind of like you attach to your knee and you bend your knee, and there's like kind of like another leg, but you put all the pressure on there.
Really?
Yeah,
Wow.
it's just, I mean, people come out with things all the time.
Sure. Right. Well, you stay up to date on everything, and then you make recommendations to your patients.
Correct.
Okay, because I can see how in everyday life with a foot injury, it's so difficult to get around. You can hurt your hand,
Right.
and you can still get around, have a good time, go to Disney, wait in the lines, walk 5 miles, 6 miles, but you get a foot injury, changes the ball game. Everything's different.
Right, and the same thing too, as you get older, your coordination and balance isn't the same. So you might need the scooter more compared to like a 20-year-old who breaks it on crutches, who can use crutches.
Right, I can't use crutches. I had that knee injury, I've had a foot injury, as you know, and I just can't do the crutches. It hurts more on my upper body in my hands than it does anything else.
Right, and I mean, most times that people end up, getting more serious injuries from the crutches because they lose their balance or something like that.
Yeah, secondary injuries from having to use crutches, right?
Yeah.
That's great. All right, so as we're talking, I have to tell this story. And I went on a cruise with some friends, and one of my friends, I'm not going to mention names, but he suffered, he had, I guess, some diabetes issues in his family, and he had neuropathy.
Correct.
And he was walking around on the cement in the pavement without any, protection for his feet. And as he picked his foot up, we could see that he had horrific burns. And they were so bad that he immediately had to get taken on a golf cart right up to the ship. And when we got back to port, I called Rob. First thing I did was I said, Rob, my buddy's in trouble. And without mentioning names, why don't you tell him what you saw when you arrived at your clinic to meet him?
Yeah, it was pretty bad because he didn't have any feeling to his feet. So some people have diabetes or different medical comorbidities. Other people have like back injuries where they lose the feeling, the nerves that feel to their feet and things like that. And he didn't feel anything. And what happened is he was on something really hot, and it burned at least the bottom of his foot, where it scraped off all the skin and tissue underneath. And he had a 2nd and 3rd degree burn, and it was, serious, because people get infections and end up getting amputations and things like that for their feet. So ended up healing, and it was just, amazing.
Oh, well, you did awesome work on that. So do you see that on a regular basis where people have serious burns on their feet, or, times when you have to do, what do you do, debridements, things of that nature? Can you describe what a debridement is and kind of tell people what you have to do to fix the feet when they're like that?
Sure. So that's actually one of the phases in wound care. So there's 3 phases of wound care, and basically what happens is that when you have like dead tissue and things like that in the wound, it's going to stall the healing. So the healing won't allow it to form new skin.
Okay.
And regular skin to where it was.
Mm-hmm.
So basically when you debride it, you actually bring it back to get a fresh start, so it can go through all the 3 phases again and heal. So basically what happens is that you stimulate the blood flow and the necessary healing properties that your body has to allow it to heal.
Wow. Yeah, that's some serious work there. I can't even look at photos of things of that nature. But anyway, so what I would say is that as far as my friend is concerned because I can only laugh and joke about this a little bit now because you're better, but his brother called him Chief Raw Paw, which might be the funniest thing I've ever heard my entire life because it's so descriptive, but it's so funny, but only because he's okay. Anyways, but other than that story, just tell everybody before we go a little bit about where they can reach you, the phone number, and and where your office is.
Sure. So my office is located in St. Pete on 37th Street North. My phone number is 727-384-3338, and you can call and make an appointment during normal business hours.
And one more thing, because he's too humble to say this, but he's also a veteran of the United States Army. And for that, I want to thank you for your service because, dude, military are heroes to me. And I want to thank you for that because that's really awesome.
Thank you. I appreciate it. I appreciate your support and anybody that supports the military as well.
Excellent. All right, very good. Well, that you've heard it here at the injury, the personal injury guru, David Papa, and we're going to be right back after these messages. Welcome back to the Personal Injury Guru Show. And as promised, we went over some very, very interesting topics on foot injuries. Not only the injuries, but the conservative care. There's so many different types of injuries you can have on your foot. And of course, Dr. Abady was very clear on how he fixes all of these types of issues. Some with boots, some with orthopedics and different types of materials here that they can cut out for certain areas, and they mold them for each individual injury. He's talked about when you would put in screws and fasten them in for fractures. He talked about why the boot is so much better now than wearing casts, which were horrible. And of course, he talked a lot about just different injuries and how he can help you if you have a foot injury. And that's important because we also talked about what are the secondary issues when you have a foot injury, and the limping that goes on, and the back injury because of it. And of course, if you hurt your right foot, your left knee are going to start bothering you if you limp. It just leads to an awful lot of problems. And when you get into an automobile accident or a slip and fall, and you have these types of injuries, Dr. Abady can help you. And it's very important that you get those cleared up. So, if you like my podcast and you find that it's educational, which we're shooting for, make sure you like it. That's very important. You follow it. And of course, subscribe to it. And if you ever need to find me, you can on my social media network, which of course is it's actually dpapa at papainjurylaw.com. And you can always reach me at 727-500-LAWS, LAWS. And it's very important, of course, that you let your friends know, because these are all issues that we're presenting to you that are helping you understand what goes on behind the scenes if you have an injury. And today, of course, is with foot and ankle. So thank you very much, and we appreciate it. And we'll see you the next time on the Personal Injury Guru Show.